Welcome to the third and final video in this sequence where we will be talking about lifestyle habits for bariatric surgery. First, we do ask that you avoid alcohol after surgery. The main reason for this is after surgery, your addiction receptors are actually quite heightened. So things that are already addictive substances such as alcohol, drugs, and nicotine, we will for sure want to avoid after surgery. Specifically with alcohol, our program recommends that for an entire year after surgery, we do not have any alcohol. After that year, we kind of leave it up to the patient, but it is recommended that if you are having alcohol, that you have it very infrequently and in very small servings and portions. Another thing that kind of goes along with alcohol is, unfortunately, alcohol is one of those empty calories that we talked about in an earlier video. So we do want to make sure that we're avoiding those empty calories where we can. Something else that can pose a risk with alcohol consumption after bariatric surgery is that it can lead to rapid intoxication, which can pose a safety issue. Our program asks that we do not have any nicotine consumption at least 6 weeks prior to surgery, as well as lifelong after surgery. So that would include anything that has nicotine, whether it's smoking cigarettes, vaping, chewing, again, anything that would include nicotine, we'd want to completely avoid. The main reason for this is if we do have nicotine in our system, it can definitely alter our ability to heal after surgery. And that is one of our biggest things after surgery, is making sure that you are safe and healing properly. Long term, this can pose an issue nutritionally. Nicotine does cause nutrients in our blood system to not be absorbed or utilized properly. So long term, it can actually cause malnutrition. As for exercise, we just ask that you start where you're at because everyone's going to be starting at a different place. So for some people, it might be something low impact that they need to start with, such as light walks, swimming, water aerobics, or chair yoga. Other people might be able to start at a higher pace. So again, just starting where you're at and kind of working up as you are able to do so. On the bottom of this slide, you'll see 4 different words: frequency, duration, intensity, and type. And a lot of times people do keep in mind that some good ways to challenge our bodies are to increase the frequency and duration of our exercise. But oftentimes we forget about those other 2, intensity and type. So that's something to consider as you're adding to your exercise routine. How can you make that exercise more intense? And also, how can you change up what you're doing so that you're giving your body that challenge that definitely helps us get out of a weight plateau, and in other words, can help us lose excess weight. We also do have a support group. We leave it up to our patients if they would like to join, but of course it is highly recommended that each of you joins our support group. There is more information on our website of when those are and how to join for that. But it's a really fun thing that we do, so that everyone can kind of join together. You can ask questions and just kind of feel like you have that community. Daily vitamin supplementation is important for meeting all nutrition needs after surgery. So we will actually talk more about vitamins in a one-on-one appointment. So this will become a lot clearer at that time. But I just want you to know off the bat that vitamin supplementation is not only recommended, but required by our program for daily use after bariatric surgery. Main reasons for this are to make sure that we're preventing malnutrition, preventing muscle loss, bone loss, and another one would be hair loss. And that is what we tend to see with patients if they're not, or one of the first things we tend to see if patients are not meeting their micronutrient or vitamin needs, is they will have a lack of energy and unfortunately hair loss. So this is important for a ton of reasons. And then lastly, I just want to say that your mental health is of the utmost importance during this process and throughout the entirety of this process. Unfortunately, if our mental or emotional health is not taken care of and consistently tended to, it is almost impossible to make lifestyle changes, but it is even more impossible to sustain or keep with those lifestyle changes. So, our program does have you meet with a therapist before surgery to get that therapy or psych approval. But I do highly encourage, and the rest of our team highly encourages, that you continue to meet with that therapist throughout this process. So, meaning after surgery as well. So, that is it for this video series. We look forward to seeing you soon in the future.